Namaskar दोस्तों, welcome to channel Toxicology on board. Today in this video we'll be discussing another DABT topic, that is case control studies and retrospective studies. So let's directly dive into the question. This question is taken from ABT, that is American Board of Toxicology recertification question paper year 2003 part C. Earlier this type of questions used to have 150 questions. So in that from part C this question is there. So still these epidemiological studies or retrospective studies or case control studies are still part of ABT syllabus. You can go back and check DABT brochure 2026. So we'll discuss two questions and we'll try to learn the concepts from this question. Okay, so the question is, a retrospective study is characterized by all of the following except. So we need you to identify what are the statements which are applicable to retrospective study. Okay, let's go to the first statement. Retrospective study is less expensive than a prospective study. So, before that, we need to understand we are discussing the topic with respect to epidemiological studies. If you look into epidemiological studies, they're basically classified into two types, that is descriptive studies, second one is analytical studies. In the case of analytical studies, also, you have case control studies, cohort studies, cross sectional study. In the cohort study, also, you have two types, retrospective study and prospective study. Retrospective study, it will go in this direction, okay, whereas in the case of prospective study it will go in backward direction. Already the incident has happened, already now you are collecting the data from the patient, okay, that is in the case of retrospective study. So first statement is retrospective study is less expensive than prospective study. That is absolutely true. If you're planning some study, then you have to pay to the patient to collect the data, everything you have to enroll. So this will cost you economically more when compared to retrospective study. Okay. Second one is retrospective study. The relative risk may be estimated. Okay. If you look into last video, we have discussed about different types of risks. That is relative risk, attributable risk. So in that we have discussed about RR, that formula, population exposed by population unexposed. So in case of retrospective study, relative risk may be estimated. That is correct based on incidence of odds ratio. Third option is incidence rates may be computed up. Okay, so what is the definition of incidence rate also we'll see in the next statement. So this can be calculated, this can be computed in the case of retrospective study. Okay, the control selected must be disease free. Okay, how the controls are there, that concept also we'll discuss now. Past exposure levels are easy to quantify. Okay, this is a challenging because already the exposure has happened, so we are unable to quantify, we cannot reach each and every exposed patient and we cannot identify. So exact past exposure levels, to quantify them, this is a challenging. Okay, that is the reason this is not a characteristic feature of retrospective study. So we'll see what are the concepts that we can learn. No, before that also we'll see another question, then we'll learn about the concepts. Second question is from the same question paper with respect to case control study. So case control study is also a type of analytical study under epidemiological studies. Okay, so a case control study of mesothelioma in workers exposed to asbestos is conducted. So again you have to remember one, there are previously multiple questions on this topic with respect to mesothelioma and its association with asbestos. Even the historically, if you see there, I am not remembering, I think that is in US, there was a mining where asbestos workers were exposed to this asbestos fibers. Those fibers went and accumulated in the lung because of the particle size. For that reason only, some of the guidelines with respect to workers inhalation safety also came into. So definitely one question with respect to mesothelioma or asbestos exposure like this, you will get it in your exam. Okay, so but now they have connected this with the case control. So once again we'll see the statement, a case control study of mesothelioma in workers which are exposed to asbestos is conducted. So they have already, they're doing a case control study. The relative risk figure obtained from this represents. So we need to find. Previous video we have seen RR ka, relative risk, one formula is there. An odds ratio of occurrence of asbestos exposure and control. So they are going to make a ratio comparison between the control, the amount of workers which are not exposed to asbestos, and the amount of workers amount means number of workers which are exposed to asbestos. So there is an odds ratio is there. That odds ratio is nothing but your relative risk. So this relative risk can be used as a measurement for this case control study. Okay. So what are the other options? We'll see statements. The incidence of mesothelioma in asbestos exposed workers compared to the incidence in unexposed workers. Here the word incidence is not applicable. Okay, ratio is correct, not the incidence. Next one is the prevalence of mesothelioma in asbestos workers compared to prevalence in unexposed workers. Again, the word prevalence, because of this particular statement is not right. Next one is an estimate of the diseased risk in the general population. We are not checking it in the general population. We are checking in the worker population. Last one is none of the above. That is the reason the right answer will be in the green text, that is odds ratio of occurrence of asbestos exposure and controls. Concept that what we have to remember with respect to case control study or retrospective studies or epidemiological studies is epidemiological studies is a bigger umbrella. Okay, we are not discussing about preclinical studies. We are not discussing about clinical studies. We are discussing about epidemiological study. For example, in a certain area, some contamination in the lake. For example, in West Bengal, arsenic levels in the lakes in the West Bengal, or Bhopal gas tragedy, where methyl isocyanate was released, or Sivosa disaster, where TCDD was released. Okay, those are the incidents happened. Accident has happened, then so and so population got exposed. Now you start collecting data from that population based on, as I told you, zones will be there. Immediate exposure will be zone 1 to some area, some these many kilometers zone 2, then these many kilometers zone 3 will be there. You do some population collection of the data you will be doing. Okay, so that comes under epidemiological studies. Nowadays, there are a lot of questions with respect to ecological risk assessment, epidemiological risk assessment, particularly from the European countries. They're asking for PEC, PNEC ratio. So these are also a part of your DABT syllabus. 2026 brochure, they have mentioned this one. Under this all comes under risk assessment only. Okay. So coming back to epidemiological studies, we have two studies. One is descriptive studies, another is analytical studies. In the case of descriptive studies, you have case reports. For example, so and so person who has X person who has attempted suicide, and he has consumed so and so these many tablets acetaminophen, or these many tablets of morphine or something like that. That will be individual person, so that will comes under case report. On that also you will write lot of publications also. Individual case reports will be there. Case series will be there, where a group of population got exposed. Okay, similar type of events. Then ecological studies, as I told you, ERA reports you can prepare. Coming to analytical, you have case control study, cohort study, and cross sectional study. In the cohort studies also you have retrospective study and prospective studies, based on which direction, whether it is going in the future or in the past. Based on that, okay, we'll discuss three types in next slide. The epidemiological study, first we need to identify what is the case. So this information is taken from Caseret, that is Caseret and Dowell. This document has been, this particular textbook is recommended by the DABT only. So from that we can, since we cannot read complete chapter, we are only discussing the CD summary. Earlier with the textbook we used to get Caseret and Dowell, Clayson textbook only summary, that only we are discussing. Definition of case is important because spectrum of disease implies how you are going to identify based on the symptoms. Okay, large range of clinical manifestation, whether redness in the eye, or oozing, tears coming out of, or agitation, like that symptoms will be there. A large range of clinical manifestation, because diseases are mainly based on the symptoms, and because this definition may affect the comparability of the results among different studies. Okay, this particular clinical symptoms might be differ from each and every study. Direct age adjustment of mortality in a given population implies that application of standard death rates for the various age groups to the age groups within the study population. So this comes under case only, case study. Okay, so what is a cohort study? We'll see. Cohort study will assesses the frequency with which the disease occurs, how frequent the disease is happening, once in a month, twice in a month, or twice in a year, like that. can be retrospective or it can be prospective. Retrospective is backward and prospective is towards in the future. Use controls which are not exposed. So this was there in first question option. Okay. In case of case control study, the odds ratio help estimate risk. This case control definition also was there in the second question option was there. Individuals with disease and without are paired and exposures are investigated. In case of cross sectional study, it will define group in terms of disease. Dependent variable, if the disease is there, how much amount of is exposed, whether he has put some PPE or not, and what kind of, whether males were exposed, females were exposed, if there is a age related thing is there. So this dependent variable and characteristics, independent variable. Randomization, stratification and blinding. If you look into preclinical studies, no, for example, you are conducting a 28-day repeat dose toxicology study in the case of rat, it becomes very easy for you to select a group of rats from a particular strain and so gender with 9 weeks of age or so and so body weight lying between 350 grams to 250 grams to 350 grams like that. But when it comes to clinical trials, when you enroll the patients, it becomes much more challenging for the principal investigator to get the patient under certain body weight or with certain selection criteria. Okay, so this randomization, stratification, and blinding based on preclinical and clinical, they have their own challenges, more challenging with respect to clinical trials, enrolling the patients. But the major agenda for randomization or stratification, all this thing is harmonizing the exposed population to minimize artificial distortion in selecting a sample population. Whenever you're selecting a sample population, if there is huge variation, if there is a variation in the average of from one end of the population to second end of the population, it becomes very difficult to interpret the results. Okay, incidence rate is the frequency of an abnormality. Incidence rate is defined as number of animals developing the abnormality in a certain time. Okay, so we'll see three types we'll discuss. One is case control studies. Under case control studies, what is the case control study is a group of individuals with a particular outcome, cases, and group without a particular outcome. So you're going to compare control with the cases. Okay, information about previous exposure is obtained. Okay, for cases and controls, and the frequency of exposure is compared for the two groups, that is control and cases. In case of case control studies, both exposure and diseases are normally considered to have occurred prior to the enrollment in the study. For example, I told a person is there who is attempting some suicide. He has drink some phenol or some kind of chemical. Already the incident has happened. Okay, occurred means here normally considered to have occurred prior to enrollment in the study, whereas in the case of clinical trials, you enroll the patient based on your inclusion and exclusion criteria, whereas in the case of case, incidental case, suicidal cases will be there, no, in that case already the incident will happen. Okay, a patient has already been exposed. Second one is cohort studies, which is also called as follow-up studies. Here the incidents have happened. Again, you go and do it's a like more like a survey type. You go and ask the exposed population, and that too over a period of time. That we'll see. Understand. A cohort can be defined as a designated group of people who have led a common experience, exposure, are then followed up or traced over a period of time. This we'll try to understand with example of Bhopal gas tragedy, okay, which took place in India, so and so state, okay, where a factory disruption took place, accident took place, and methyl isocyanate released into the atmosphere. So there were immediate 50 to 100 workers, for example, they're working. They got exposed to this particular methyl isocyanate. Exposure has already happened. Now you take this 100 people, the sample, and you follow them on immediate exposure. You write down the symptoms. What are the clinical manifestations they are showing? Then you follow up after 24 hours, after 48 hours, after 1 week, after 2 week, or after 1 month, after two months, up to 1 year, up to 5 years. Like that, you will keep following these people in the form of surveys or in the form of questions, and you keep asking them. Incidents have already happened, exposure has happened, because there are certain effects which might happen, delayed effects. The effects you will see after a long period of time, even though at present you are not still exposed to that particular chemical. Okay, so are then followed up or traced over a period of time. That comes under, that's why it is also known as follow-up studies. Cohort studies proceed conceptually from exposure to outcome. Okay. Next, study groups are identified by exposure status prior to ascertainment of their disease state. For example, Bhopal gas tragedy only took place. I don't take the samples from some other, from Kerala or some other place, or from somewhere population from America, because there is no meaning. No, the exposure is happening in a certain area, certain population. So at that time only you define, this is the population where I am going to ask that certain questions. Okay, group of exposed and unexposed are identified. Okay, if you want to compare with uncontrolled, you will be checking with unexposed population. That is no doubt. Both exposed and unexposed groups are then followed prospectively. Prospectively means towards the future. Okay, in an identical manner until they develop the disease under study, until the study ends. Certain times the patient will die, the subject will die, or certain times the patient will no longer want to be part of that particular survey. So he will lost the follow up. You will or he will leave that state and he will leave. Okay. Next one is relative risk. Relative risk is, which is a part of cohort studies only, estimated as the ratio between risk in the exposed groups in the unexposed. See, already we have seen in the previous video also, relative risk, one question will be coming. Formalize population exposed by population unexposed. That you have to remember. Both cohorts should have similar characteristics, means the groups. Okay, control and this thing, except for the exposure under investigation. If you are comparing male population, compare it with male population only. Okay. If you are comparing children population, compare it with children population only. Like that. In some studies called retrospective cohort studies, exposure and outcomes both lie in the past, before enrollment, before being part of that particular study. That will be there in the case of retrospective. Now we'll see the third one is cross-sectional studies, which are something like surveys. So these cross-sectional studies or these surveys, no, they will examine the relationship between a disease or other health related characteristic in a population at a given time, means at a specific time, snap time. Within, they will select within this period. Like I will collect the data from Jan 2026 to December 26. There is a snap time will be there. Okay, fixed interval will be there. The presence or absence or the level of a characteristic is examined in each member of the study population or in a representative sample. These studies are used to obtain information not routinely available from surveillance or case series. So we have seen what is case series, which will part of descriptive studies. Cross-sectional studies provide no information on the temporal sequence. Here, the key word you have to remember, what is the temporal sequence? As I told you, temporal sequence means it is in the present. There is a snapshot of a population. So, cross-sectional studies collected data on exposure and outcome simultaneously. Both exposure is also happening at the same time, and you're fetching that particular patient who is exposed. No, you're asking them immediately on that particular time only, on that snap time only. As an incident has happened, and later on you are going and getting the information from that particular patient. Okay, so creating a single snapshot of a population, which makes it impossible to determine the temporal sequence of cause and effect. Okay, that's why you have to remember no information on the temporal sequence of cause and effect. This diagram is very important. Epidemiological studies, one more video I will be preparing where I'll be discussing about all these other type of studies also. So in surveys examining the association between an exposure and outcome, both are measured at the same time. As I told you, exposure, and now I'm getting exposed, for example, certain chemical. Here some accident took place, certain chemical. So both exposure and the collection of the data is taking at the same time. And it is often hard to determine whether the exposure preceded, whether the exposure started before or the outcome is vice versa. So we cannot establish a relationship between them. Okay. In general, surveys measure the situation at a given point, that is a given moment, that is prevalence, rather than the occurrence of new events, that is incidents. So this is, it appears to be a bit confusing, but you have to remember, you will get one or two questions on epidemiological studies, particularly from the European regulatory authorities. They have this thing for ecological risk assessment or epidemiological risk assessment. So, case control studies, prospective studies, retrospective studies, these at least statements you should be knowing, and to remember that you have to remember with examples. Then only you can understand the concept behind these types of thing, because every time you cannot depend on preclinical studies, you cannot always depend on clinical trials. Lot of incidents you have to depend on epidemiological studies. Okay, lot of incidents, for example, the Hiroshima Nagasaki, which took place where uranium exposure, atomic bomb exposure is there, then you start collecting data. What is happening with the immediate generation, what is happening with the first generation, second generation, from the female, from, like that you have to keep following the exposed population, because those incidents will not happen again repetitively. In that case, on cases we need to follow that particular population over a period of time. Okay, that's why it is called prospective studies. Okay, hope you are understanding the concept. For any questions, be you can always write a mail to arya.priyanka18 @gmail.com. Thank you so much. Be curious. All the best for your exam.